Here are some suggestions for teenagers in terms of getting better sleep. Number one, I would say, is that the child should try to awaken at or about the same time 7 days a week. Now, that's not always possible, so if the teenager wants to stay in and sleep for an extra hour on a Saturday morning or a Sunday morning, that's okay. But sleeping in till 11 o'clock in the morning or 1 o'clock in the afternoon is not good, because the child is just going to feel very tired and will have a harder time adjusting to the school schedule the following week. So that is number one issue. Try to awaken at or about the same time 7 days a week. Number two, try to avoid daytime napping if possible, so that you don't borrow from the sleep at night, and that will help one fall asleep better at night. Number three, light exercise during the day, 4 to 5 times a week is a good idea. Number four, avoid caffeine after supper time. 5, avoid nicotine at all times, because nicotine is a stimulant. It is going to interfere with falling asleep and staying asleep. And the other thing is that with regard to cell phone activity, computers, television, try to stop those activities about a half hour or an hour before bedtime, so that there is enough time to unwind and gradually fall asleep. We all have worries as well. The teenager may worry about school, friends, what's coming up the next day at school. So it's probably a good idea to keep a notepad at the bedside and write down one's to-do items or fears or worries in that diary. So it's better to worry about an issue before one gets into bed rather than after getting into bed, because once we have already done that, then there is one less thing that will keep us up at night. If one does awaken in the middle of the night, it's probably a good idea not to turn on the overhead light. A night light is okay, but the overhead light is not good. Finally, some teenagers have a tendency to go down to the kitchen, fix themselves a snack, or watch television in the middle of the night, or some may actually want to read in the middle of the night. That is also not a good idea. So I hope these little tips help your child, or if you're a teenager, they help you. If the problem of sleeping too much in the daytime or not getting enough sleep continues despite observing these sleep hygiene tips, it would be a good idea to see a sleep specialist. And here at Mayo Clinic, we are very happy to help you or your child in this regard.